Hello, everyone. With the amount of questions we've been receiving in the recent weeks on the application of the Frequencer from Dymedso for the COVID-19 patients, it seemed appropriate to organize a quick call with two experts to get some answers. I want to start by giving a special thanks to our experts for taking the time during this very busy moment. With no further ado, let's begin this Q&A session. So just for introduction, Dr. Simon Phaneuf, emergency physician, clinical teacher, and CSO of Dymedso, and Laura McIntosh, PhD in human anatomy and cell biology. Dr. Phaneuf, I'll start with you, maybe just to tell us what is the Frequencer in few words.
Yeah, the Frequencer is an acoustic device. It's a device that uses sound waves at a very specific frequency to vibrate the smaller airways, and this has been shown to be able to make the mucus and secretions more fluid and easier to expectorate. It's been used extensively in various conditions called airway clearance disorders such as cystic fibrosis, COPD, and other diseases, and it can be used on spontaneously breathing patients, also on intubated patients. We have lots of experience with the device in various settings, and the device is especially good at targeting the smaller airways that cannot be treated with conventional methods. And I guess that's the reason why we're seeing this interest for the use of this device for treating COVID-19 patients.
Yeah, maybe I'll add a little bit about the power of sound waves. So sound waves versus mechanical waves are extremely useful for treatment of this sort because sound penetrates very easily through the chest wall, through the water in the chest, and through the muscle and the bone, and allows the sound to get to the lungs quite easily and vibrate the lungs in a painless manner, basically. We know that the lung vibrates at a resonance between 37 and 42 hertz. And so we've done studies to optimize the frequency of the device. And we found that at 40 hertz is the optimal frequency to vibrate the lungs. We've done studies with collaborators at the University in Montreal, as well as with other clinicians. And these studies have been published that show that it's very effective at 40 hertz to really make the mucus more viscous and to vibrate the lungs and clear those lower airways. We've also done studies with cystic fibrosis patients in a double-blind clinical study that shows that we can get very good mucus expectoration with treatment, as good as or better than with the standard of care treatment. So we know that the treatment is effective, we validated that it's effective, and we also know that it's very easy to use, convenient, and safe.
And I would add that it's important to clear the smaller airways because, I mean, it's easy to conceive that if there's gradual obstruction and plugging of the smaller airways, this will eventually lead to the patient having difficulty breathing. And moreover, the thing is the mucus normally in the lungs will trap the viruses, bacteria, and small particles to protect the host. But when the secretions are trapped, it creates a good medium for bacteria and viruses to proliferate. And then this will further inflammation, lung swelling, and lung damage, and in some patients, permanent lung damage. So clearing the airway of this mucus and secretion is quite important.
Do we have similarities between all the other respiratory diseases that we know now and the COVID-19?
Well, actually, COVID-19 is a viral infection like many others, and it generally causes death through what we call ARDS, adult respiratory distress syndrome, which is not a new disease. I mean, it can be caused by viral infections, bacterial infections, and even other processes. So the pathophysiology underlying severe COVID-19 is not really new, even if this virus is new. So, and we have a lot of experience using the Frequencer in various settings in other patients, and that leads us to believe that it can also be used the same way for COVID-19 patients.
Okay, we're hearing a lot on the news at the moment that it starts with a dry cough before escalating in a very different way. Do you think we should use the Frequencer for dry cough or expectorant cough?
Yeah, intuitively, we would be tempted to conclude that a Frequencer can only be used for productive cough with secretions, but our experience showed us that it can also be beneficial when the cough is dry. The cough being dry doesn't mean that there's no secretions, there's no mucus. It's just sometimes that it's too thick to be expectorated, and therefore the Frequencer can be used both for productive and non-productive cough.
Okay, makes sense. When we're talking to end users and we're talking to distributors, the question that's coming to us is, what should be the protocol for using the Frequencer at this moment?
Well, since the treatment is very gentle, I mean, it's like putting a speaker on your chest, and the treatment lasts between 12 to 15 minutes. Normally, it can be done like 3-4 times a day. But in sicker patients, it could be done easily every 4 to 6 hours as needed.
Laura, question for you. Oh, sorry. Go ahead.
Well, and we have a protocol that we developed to help clinicians use it on COVID-19 patients. That is pretty similar to other conditions. Is
this protocol available at the moment?
Oh, we can share it upon request, no problem. Sure.
That would be good. Laura, question for you. Should we use the Frequencer differently on an intubated patient?
No, the Frequencer can really be used the same in an intubated patient as a non-intubated patient. In fact, we've used the Frequencer in neonates quite successfully that have been intubated. So it's very gentle and safe. We would recommend using the same frequency, so 40 hertz that we've optimized, and just dialing down the intensity a little bit. So we would recommend a 75% intensity. Since the patient would be intubated, they would be able to perhaps tell us if there was some discomfort. So we would just suggest the 75% intensity.
Will you use the same 75% intensity in dorsal position as ventral decubitus? Or for the prone position, as we know, that can last 16 to 24 hours a day, is it contraindication?
Right, I can take that question as well. So in the same vein as the frequency, or not requiring a separate protocol for intubation, it's the same. We can use the Frequencer in a prone position or a supine position, since the sound waves travel equally from either side of the body and they go through to the lung very easily. So we can apply it either side and at the same frequency. It doesn't matter on the position of the patient.
Okay. Simone, with all the experiences that we have on the Frequencer at the moment and the ICU, how long after the session tracheobronchial aspiration will be needed?
Oh, that's another good question. Obviously, depending on the amount of secretion, it can vary, but you can expect, if there's a lot of secretions and mucus, you can expect production of secretions for up to 30 minutes. So this may be, and the Frequencer is very good at clearing the smaller airways, and the smaller airways will drain into the larger ones, and this may need to be aspirated for at least up to 30 minutes after the treatment.
Explaining the technology at the moment to some of the distributors and end user, a lot of them are kind of nervous about intubated patients. So do we have a lot of feedback coming from this intubated patient before COVID, since the Frequencer is on the market?
Yeah, as Laura, I think, mentioned, it's been used extensively in both intubated and non-intubated patients. It's been used on neonates and infants, intubated neonates and infants, and it's very safe. Actually, it's much safer than standard chest physiotherapy. It's been used after like lung transplant patients with that had thoracotomy, and on which we cannot do standard chest physiotherapy because it's gentler. So there's no, it's very gentle, very safe, and you'll see the efficacy quite rapidly.
So we bring the protocol to people, they will use it. Now, the biggest question is, how do we measure the success of using the Frequencer with this COVID patient? What will be the reference points?
As I just said, the effect of the treatment is seen very rapidly, easily within 30 minutes. So if you want to measure success, you just have to take some parameters, for instance, respiratory rate, level of dyspnea or work of breathing, arterial blood gases or oxygen saturation before the treatment, and then you measure again the same parameters, maybe 30, 60 minutes afterward, and you'll get your answer. It's as easy as that.